Welcome everyone, and it gives me great delight to introduce our presenter tonight, who's presenting the didactic, Norbert Hödebeck-Stuntebeck, who is a psychologist and psychotherapist and supervisor who resides in Bad Oeynhausen, Germany, where he currently serves as a project manager, Prader-Willi syndrome, and also for project manager adipositas, which is obesity, for Diakonische Stiftung Wittekindshof, and I probably got that all very poorly said, which is a Lutheran foundation. I can see Norbert laughing. Foundation in the northwest of Germany. He received his PhD in 2012 at the University of Erstadt by a study about the competence of people with Prader-Willi syndrome in charge of perspective. And since 1996, he's been responsible for the development and differentiation of support for people with PWS of all ages and in different fields of living, working, school, and training programs. His interest research is focused on empathy or change of perspective in PWS and the development and evaluation of training programs. Another field of interest is obesity in people with other learning disabilities. So Norbert is very kindly going to speak to us today on socialization and communication in people with PWS. Thank you, Norbert.
Thank you, Georgina. I'm still laughing a little bit because I know about my name, and there are so many funny stories about this Hödebeck-Stuntebeck and married in Jöllenbeck and all these things. And so, and the other thing, this company I'm working for, the Diakonische Stiftung Wittekindshof, it's a complicated things here. Yeah, so thank you so much for the first words, and thank you so much for giving me the chance to talk about this topic or this theme of socialization and communication in PWS. And it is really a big theme, and maybe we have 2 or 3 weeks, then I think we can talk about all the aspects of these things and all the experience I think all of us have in this theme. I think I want to focus a little bit on the on the environment where people are living and what it means, and focus in the second part more on the communication and what does it mean, and what how we can understand, and how can we see the problems in this. So I think at first I will share my screen and make possible that you can see the screen. Okay, thank you. And now I try to handle this with yeah, good. This. Okay, so yes, socialization and communication. So the first thing I want to show, or I want to explain, is what is the social environment in which people with Prader-Willi are living, and how many people are involved, and how many different entities are there. So like from a systemic view of the field, we can say that the people with Prader-Willi are regular, or in families they are in contact with mother and with father. So the first group, the first subsystem, which they are regularly in contact, are the parents. The others, which are there and often there, are the whole family, if these are siblings or aunts and uncles and brothers. And these are, all of them are in contact with the one with Prader-Willi, but they are in contact with each other. So there is so many network and so many interaction between these groups. And then we have the teachers, the school, medical doctors or physiotherapists, and all these are the professionals. Often people with Prader-Willi are in an intensive contact with different kind of professionals, like all you can see here. And the other big group, or the other big thing around the one with Prader-Willi is the environment, with a house of the family, with a neighbor, with a neighborhood, or the cultural society rules, laws, and all these things. And these subgroups of the environment, the professionals, the family, the parents, they interact with each other. And the thing which I will show with this picture is that people with Prader-Willi have so many influence which are coming to them, on them, and not all of them are well connected or have the same meaning. And you know that in the family, if mother and father have not the same meaning, and they say things to people with Prader-Willi in a different way, one said we go to the right, the other say we go to the left, then it's hard for people with Prader-Willi to understand these or to regulate these. And if the whole family say something others than the professionals, or the one in school and the one at home have different meanings, then it's very hard and very problematic for people with Prader-Willi to handle these individual world. And in a positive way, all these things are coordinated and go in the same way, then it could be a very positive influence of the social environment of the one. But in another case, if all these things are not coordinated and give different information and signals, then it can be very hard for the one with Prader-Willi and can have a very negative influence on them. And this picture should show that each of us, and also all people with Prader-Willi, if they are in a negative environment and the groups around them are not coordinated and informed in different ways, there is a minimum of development of the one. And on the other hand, if all are good coordinated, go in the same way, then there is a maximum of development of the one with Prader-Willi, of also all people. And in the second case, the second one with Prader-Willi could have a minimum here and a maximum there. And this means that it is not only the genetics, it is also the environment which decides about how good the development of someone with Prader-Willi is. And what I mean with these first picture I developed is that we have to know about these different things, and we have to try to coordinate these different parts of the field someone is living in, or someone with Prader-Willi is living in. And the first view is the view on a macro field, and what I will do now is to describe the things or the themes about communication in a part of this field, and have a look at these interaction between two persons, for example, between the one with Prader-Willi and the mother, or it could be the father, and to explain what happens there and what makes it easy or not so easy to do this in this big field, and how we can support them. So it's always the discussion to see what happens by the client or the one with Prader-Willi, what happens and what is in the environment, and also the parents or the staff, to always realize the interaction between them. And I try to explain or what is required to lead a conversation, and to describe what happens in a conversation, is to say you always need someone who says something, a sender. I think it is the understandable word for you. You need a message, and you need a receiver. For example, mother says something to the child with Prader-Willi, and This is the first step, but what we see in these model or in communication is that always the receiver changed his rule, and it is always a change between receiver and sender. So we have to know when we want to understand how communication works, we have to know which signals there can be and what the sender could do or will do and the receiver can do with these signals. And as an overview, you know that there are two ways, the verbal and the non-verbal, and you know that the non-verbal have 60 or 70% or in 60 or 70% the non-verbal information decides about if people understand each other or not. And the verbal ways I will show only here a little bit, the written way or the spoken way. And one of the main things in communication is making breaks and let people or give people the chance to respond something. This is often what we see when we see how our staff is working with people with Prader-Willi, that they do not make a break and give them the chance. And all these things we can, there can be variations and we can use this. But the other thing, the non-verbal ways of communication, I think it's much more interesting. And as I said, 60 or 70% depends on the non-verbal things. And we communicate with the body, with posture, gesture, eye contact, and so on, or objects. I can make it a little bit smaller, so and to communicate with clothes, which clothes I wear, or by smells or sculptures and so on. And another interesting thing is the space. So how far is the distance when we are talking, or what are the levels when we are talking? And it's always to be informed about the things we do and we signal with these non-verbal things. When we have a look at the sender, it is interesting, and maybe we can explain, or I can explain these things by this situation when a woman and a man are sitting in a car and the woman is driving and the man is say a sentence like, "Hey, it's green over there," and they are on the road and they drive, and in front of them is a traffic light. And the man is saying, "Hey, it's green over there." And the important thing is to know what he can mean by this. And he can mean that the traffic light is green, only the information. He can mean that he wants to say to his wife, "Do something, get going, go on." Or he can describe the relation between them in the way that he means that you need my help by driving the car. Or he can say something about himself, and he said, "Hey, it's green over there," but he means I'm in a hurry and wants to say to her. So what I will say is that there are always 4 levels of a message. And the first is the factual level. The man who is sitting in the car will only inform about, "I see a green traffic light," nothing more. And when he means the interpersonal level, this is a part of the message that determines how a sender sees the relationship between themselves and the receiver. Maybe he will say that she cannot drive in a good way, or that she's not able to do it by herself. And the self-revelation means that he informs with his sentence, he informs about himself, what is his situation. And the last is that maybe he's in a hurry and he wants that he drive faster. So the thing is, every time when there is a communication between the sender and the receiver, between mother and the child with Prader-Willi, the sender can mean these 4 levels. And the problem is the receiver able to understand what the sender means? And you can see that or it is obvious that there could be 75% of misunderstanding, because the receiver is not sure which one of the things are right. And you know that we mostly use the non-verbal information to understand what the sender means. But, and this is the last part, to understand this communication model, to know what what could happen by the receiver, and what could he do with the information. And these are the, I think many of you know these model of these 4 ears. And so on the side of the receiver, he could understand this or hear this with his factual or content ear, or with his relationship ear, or this with his self-revelation ear, or the appeal ear. And what we often do with our staff, or when we talk with parents, is what do you think, on which ear you often hear very intensive or more than on other ears? And the problem is, if you hear very intensive or maybe only with a factual ear, then you lose then you lose empathy, emotionality, and you only hear the content. For example, you go and walk through the street, see in a shop a ring, and the woman said, "Oh, it's a very nice ring," and the man said, "Yes," and the woman it's her birthday next day, and next day she gets an iron, and you know what I want to say is that if you only hear the facts and not between the lines, then it's very hard to be in contact with people or be in a good relation. The problem, if you have an interpersonal big ear, then one is strongly preoccupied with oneself. So always the thinking is, what does the other person think of me? How does the other person see me? And feelings and emotions of others will be neglected. They are always by themselves. They think of the relation, and always when someone is saying something to him or give a signal to him or her, then they always think about the relation, and they are not focused on their task or their jobs. The self-relevant ear, if it is very big and a large focus on wishes or feelings of others, I wonder if she's afraid, or what is with her? Why is she saying this? Is she nervous? Is she in stress? And so if I have this big ear, then I'm always I'm always by the other and not by myself, and I do not feel my own feelings and do not see what I want. And the last big ear is the appeal ear. And if I have these one in a very big way, then I always in stress, because I always hear tasks for me. Someone say a word, maybe these over there is green, and I think always what I have to do, what should I do, what can I do? And the people which have these big ear, they are always under stress, and many of them we see in a burned out situation after years. So what this model means is that every time when there is a communication, the sender have 4 options to mean things, and on the other way, the receiver have also 4 things to find out or to take out of these communications. So it is always a miracle that we understand each other. So the main reason that we understand is that we use these non-verbal information, and they help us to understand and to see if it's true what something is say or not. And for example, in the situation with the mother with the son with PWS, maybe the mother is saying, "I would like to have a nice afternoon." And in the model, you can see she as a sender says, "I would like to have a nice afternoon." And what her meaning is, the morning was full of conflicts and so stressful with her son, and I'm so tired and I need a rest, in the afternoon. And so she make an information about herself. And on the other side, the one with Brother Willie as a receiver, he understood, oh, I have to make a proposal for an activity. Mom wants to be active. So he hears with his appeal ear, and what he's saying is, oh, mother, super idea. Let's go to the shopping center and have a nice evening, afternoon together. So this makes it clear by this example how these misunderstandings could be, because each of them make all things right, but they have the chance to do it in this way. And what can we do with or for children with PWS? We have to support to increase competence of hearing on all 4 ears. I think we have to describe this concept of the 4 ears, and especially we should train them to be able to hear more on these self-relevant ears. So what is mother meaning? What is mother's feeling? What is her meaning behind her words? And on the side of mother or of us or of staff, also it should be possible that we are able to hear on these 4 ears, but special in taking care of others is the self-relevant ear. So we have to be able to think about the other and the change of to make the change of perspective, and also the factual ear, that we not always feel that he is thinking negative about me, especially in crisis situation. It's very helpful to have this factual ear and to use the meta level and know on which ear I, as mother, father, or staff, hear more and hear in this, maybe in a crisis situation, and maybe we are more flexible to use the ears in different situations. So the concept of these 4 ears, I think it could be very helpful to train and to inform about these things in communication, so that socialization could work in a better way in these very complex field in which people with PWS are living. Thank you for listening.